Pyrethrins and pyrethroids. Pyrethrum, pyrethrin, and the pyrethroid insecticides. Pyrethrum is a partially refined extract made from an African species of chrysanthemum that has been used for many years as an insecticide. Besides the insecticidal compounds, the extract may contain allergenic compounds called sesquiterpene lactones that can cause rhinitis and contact dermatitis. Most current formulations contain pyrethrin prepared by completely purifying the extract. Uses in the home and in agriculture. There are 528 formulations with pyrethrin currently registered in California. Most contain mixture of synthetic pyrethroids. Some also contain pyrethrin. Pyrethrin has low toxicity. Oral lethal dose, 2,370 milligrams per kilogram in rats. Home use occurs daily. There is daily use in agriculture. Pyrethrins and pyrethroids are also used for public health mosquito control. Dermatitis associated with pyrethrin, New York, 1930. A year of generalized eczema in a 33-year-old housewife. Negative patch test, gold powder, henna shampoo, soap, poinsettia, geranium leaf, parrot feathers, cactus leaf. Positive, black flag powder formulated with pyrethrum, resolved after discontinued use of powder. With synthetic pyrethroids, often no skin rash occurs, only a sensation of irritation, crawling insects, or numbness. The pyrethroid insecticides. The synthetic pyrethroids have chemical structures similar to pyrethrin, modified for greater stability. Some synthetic pyrethroids have much higher acute toxicity than pyrethrin. For example, the lethal dose for deltamethrin in adult rats is 81 milligrams per kilogram, especially in young animals. Lethal dose in young rats is 5.1 milligrams per kilogram. The possible differential sensitivity to deltamethrin is relevant to the discussion below of poisoning in a 4-year-old girl. Pyrethrin and pyrethroids. Mechanism of action. Two groups of pyrethroids differ in chemical structure and their pattern of effects in mammals and insects. Type 1 compounds do not have an alpha-cyano group. Examples: permethrin, alethrin, and tetramethrin. Type 2 compounds have an alpha-cyano group. Examples: deltamethrin and cyfluthrin. Type 2 compounds are generally more toxic. Both groups of pyrethroids poison sodium channels in peripheral nerves of the skin, in the airways, and in the central nervous system. Signs and symptoms of poisoning. Rhinitis caused by stimulation of receptors in the airways, burning of throat, and aggravation of asthma. Systemic symptoms in mild cases include dizziness, headache, nausea, anorexia, fatigue, vomiting, increased gastric secretions, stupor, muscular fasciculation. The duration of poisoning is similar to carbamates. Most recover between 1 to 2 days following exposure. Pyrethroid. Effects on the skin. Stimulation of nerves in the skin produces a burning sensation, itching or numbness in the skin, especially in the face, sometimes described as ants or insects on the skin. Sometimes similar effects occur in cases of poisoning with cocaine and amphetamines. There are no reactive groups that produce visible irritation in the skin. Frequently, there is no visible redness or only short-term redness. Tetramethrin, ready-to-use dermatitis. 0.25% formulation ready-to-use cause short-term irritation. Possible effect of pyrethroids or petroleum solvents in the formulation. Got better in a short time without treatment. Pyrethroids, chronic dermatitis. Persistent reaction for several months after accidental direct contact with pyrethrin, bioresmethrin. Explanation: allergy, deposition in the fat beneath the skin. Poisoning after ingestion of synthetic pyrethroid. The mother of a 4-year-old girl, previously in good health, found her lying unconscious on a sidewalk outside of her home 20 minutes after she went outside to play. Her mother also found half a piece of insecticide chalk by her side. It seemed likely that the child had eaten the rest. The label indicated that this product, imported and sold illegally, contained the synthetic pyrethroid deltamethrin. The girl liked to eat a stick of candy sold in a package quite different from the insecticidal chalk. However, the chalk stick was very similar in color and shape to the stick of candy. Illegal synthetic pyrethroid. The chalk was sold in 99-cent stores in San Diego, in other parts of the state in flea markets and Asian stores. Laboratory analysis showed the chalk contained 0.98% deltamethrin. The ingested dose was estimated as 34 milligrams or 2 milligrams per kilogram. Treatment. When the ambulance arrived, the girl was awake but lethargic and had difficulty standing up. In the hospital, she was in a stupor, but could speak. There were no other specific abnormal findings. She was given 20 grams of activated charcoal. She was hospitalized for observation and recovered within a day. Children's sensitivity to synthetic pyrethroids. This case indicates that there are effects of deltamethrin in a dose of 2 milligrams per kilogram. It is possible that children have a sensitivity not present in adults, expected to become ill at a dose of approximately 10 milligrams per kilogram. The chalk is similar to a children's candy. There is a risk of ingestion that is not found in the great majority of adults. Occupational illness outbreaks. Outbreaks of witness have occurred associated with the use of pyrethroids in agriculture. Symptoms were similar to hay fever, but were probably related to stimulation of respiratory tract receptors. 1997 outbreak in Tulare County. 55 workers picking oranges in orchards treated with cyfluthrin 3 to 10 days earlier. Irritation of airways, redness, sneezing, cough, sore throat, nausea, headaches. Most recovered the same day. Safety. Fires and insecticide foggers. Multiple fires linked with foggers. Fires related to inert ingredients, petroleum solvents, and propane gas used as a propulsive agent. Emergency management. Unlikely residual insecticide after the fires. An explosion occurred in San Diego, 2003, after application of 19 foggers in a home of 475 square feet, northwest of Balboa Park. Lodi, California, July 9, 2006. A single fogger was applied, but the pilot light was not extinguished. Safety. More fires. Insecticide foggers. Similar fires have occurred elsewhere in the United States, occasionally reported in the press. August 12, 2006. Cronenwetter, Wisconsin. Number of foggers not reported. October 18, 2002. Oak Ridge, Tennessee. Owner used various foggers, left the house without putting out the fire in the fireplace. Evaluation. There is no blood test comparable to cholinesterase. Pyrethroids are metabolized in mammals by hydrolysis, oxidation, and conjugation, and it is possible to measure various metabolites in the urine. However, there are no commercially available tests. Pyrethroid residues can be measured in the environment, on clothing, or on the skin. First aid. Avoid additional exposure. Skin contact. Remove contaminated clothing and wash. Decontaminate the skin with soap and water. Eye contact. Irrigate immediately with clean water for at least 10 minutes. Ingestion. If the patient is conscious, then induce vomiting. The patient must be taken to an emergency room as soon as possible. Inhalation. Keep the subject under observation and transport to a medical facility if necessary. Medical treatment. Unlike the carbamates and organophosphates, there are no specific antidotes. Decontamination. Vitamin E cream for skin symptoms. Effective if used within 3 to 4 hours of skin contact. Albuterol inhaler in case of asthma. Gastric lavage, activated charcoal, intestinal catharsis after ingestion of toxic quantities. Other symptomatic treatments. Summary: pyrethrum, pyrethrin, and the synthetic pyrethroids cause illness through contact with the skin and airways. In case of ingestion, systemic effects occur. The products are used in the home and in agriculture. There are illegal products for sale in California and elsewhere that present risk of serious illness when there is an unexpected exposure to children. Discussion: how are cases related to pesticides or violations of proper application procedures reported? Reporting of cases. Reporting of illnesses. Report by the doctors treating the affected cases. Contact the Agricultural Commissioner in each county. State offices for reporting. Office of Environmental Health Hazard Assessment. Sacramento telephone 916-327-7319. Sacramento fax 916-327-7320. Oakland telephone 510-622-3170. Department of Pesticide Regulation, Worker Safety Branch. Telephone 916-445-4222. Fax 916-445-4280. California Poison Control System. Telephone 800-222-1222.